Hi guys, my name is Dr. Veera Gupta from Optimum Health Chiropractic, and this is going to be the first of two videos on what to do about Osgood-Schlatters or Shin Splints. So runners typically and people who are jumpers or on a trampoline, they can get what's called a shin splint. What it is that this bone right here, this is called the tibia. The lower leg has two bones. Tibia is out here, fibula is a little guy on the outside. Well, what happens is the tibial tuberosity is a piece of bone that will later on as you age fuse to the tibia, and it's a bump. So if you feel your shin, you'll find a bump on it, that's the tibial tuberosity. Okay. Well, what happens with shin splints is the muscles that go into the tibia, if you feel down, you'll feel like a spine. That's where the muscles insert. Now, right here, this is one of the two muscles that allows you to pick your foot up and down, okay? So there's anterior and posterior tibialis, because they're on the front and the back of that. Well, what happens is when they get tight, they give you shin splints. So you have to loosen those up, because sometimes if you're growing, what happens is the bone is growing quicker than those muscles can keep up with. So you keep stretching them because they insert into this. So those are the two, anterior and posterior tibialis. But then you also have to make sure that your calf muscle, which is back here, that's made of two different muscles too, which are gastrocnemius and soleus. And they sit on top of each other and they get stuck together. So one of the things you can do, you can literally find your Achilles, which inserts into the back of your heel, grab on either side of it, pull your toes up. Or you can use a band and pull your toes up while you do this. And that'll give you a nice little stretch here. But those are going to be common culprits for people who have calf pain. Now, if you just flew, obviously you have to check for other things like having a blood clot in your leg. But for your normal person who's not been flying, it's usually these four muscles that you need to loosen up.